Hi, in this lesson I'd like to give a brief overview of GI anatomy, gastrointestinal anatomy, in particular the structures comprising the head and the neck region. First is the pharynx. The pharynx is the beginning part of the tube that allows food to enter. This is the connection between the esophagus and the oral and nasal cavities. The pharynx is composed of three compartments, or is segmented into three sections. First, the laryngeal pharynx, because it's behind the larynx. Second is the oral pharynx, because it's behind the oral cavity. And finally is the nasopharynx, because it's behind the nasal cavity. The pharynx is bordered in front by the nasal cavity, oral cavity, and the larynx, and behind by the vertebral column or spinal cord, and to each side by the common carotid, which splits off into the internal and external carotids. So first, for the nasal cavity. The nasal cavity is where most air goes through when you're breathing through your nose. It has a relatively large surface area for its volume, which is composed of turbinates, which are these bone-like structures that protrude from the nasal cavity to allow the nasal cavity to humidify and heat up the air going into the lungs. The air from the nasal cavity goes into the larynx, which is this unique structure that contains your vocal cords, and empties into the trachea, that separates in the carina and then goes into the left and right lungs. The oral cavity is right behind your mouth and contains the tongue and a variety of lymphatic organs, muscles, and other tissue that helps digest and masticate food. Masticate meaning chew up. The airway and the GI tract is separated by the epiglottis and the larynx. The larynx actually moves up when you want to swallow, so that the epiglottis folds over this cover, which prevents, or for most of the time prevents, food from getting into the airways. The oral cavity also has a ring of tonsillar tissue called the Windler's ring of tonsillar tissue, and is composed of four main regions. First, let's talk about the tongue. The tongue is actually a huge muscular organ that is separated in the back by a terminal sulcus, which looks like this triangular region. In front of the tongue, or in front of the terminal sulcus, is the tongue that you normally see, which is used to moisten, digest, and move food around. Behind the terminal sulcus is actually a tonsil, the lingual tonsil. This lingual tonsil is part of the ring of tonsillar tissue. In addition to the lingual tonsil are two palatine tonsils. These are commonly the tonsils that you would have removed when you get a tonsillectomy, and sit on the wall of the oral cavity between two sheets of muscle or membrane, commonly called the palaedoglossus and the palidopharyngeus, which are two sheets that help separate the oral pharynx, or separate the oral cavity from the nasal cavity and the pharynx. On the top is also the tubular tonsils, as well as the pharyngeal tonsils. So you'll notice that for the oral cavity, there's actually this ring of tonsillar tissue. That helps protect the body from foreign invaders and bacteria, which closes upon any this allows contact with any kind of, I guess, food or liquid that goes into the GI tract. In the larynx is composed. The larynx is surrounded by a couple major cartilages and bones. First is the hyoid bone, and then followed by the thyroid cartilage and the cricoid cartilage. The thyroid actually resides a couple of inches below the thyroid cartilage and has a butterfly shape. Although the pharynx is right in front of the vertebral column, there's actually a retropharyngeal space. This means that there are two layers of fascia between the vertebral column and the pharynx, which allows for continuous space that goes all the way into the mediastinum. This gives the pharynx room to expand and contract when food goes down your esophagus, this also means that if there's an infection in this retropharyngeal space, this can go all the way into the mediastinum and cause systemic infection. Let's talk about the blood supply. On the neck there is a bilateral carotids on either side of the neck, which splits off into the external and internal carotids. The external carotid splits off into multiple arteries, whereas the internal carotid goes directly into the brain. The external carotid goes into a couple main branches, which I often like to call, or I like the mnemonic Thanksgiving is made for loving turkey, which means that at the very top is the temporal artery, followed by the maxillary artery, and then the lingual, or the facial, the lingual, and then the superior thyroid, where the thyroid is the turkey. In terms of musculature, there are multiple muscles that encapsulate and constrict the pharynx, as well as allow for digestion and mastication of food. First, for the pharynx, there are three major layers of muscle, which go from the back to the front, is composed of the inferior pharyngeal constrictor, the middle pharyngeal constrictor, and the superior pharyngeal constrictor. In the far back, so if you were looking from posterior to anterior, the first muscle you would see is the inferior pharyngeal constrictor. This is connected to the thyroid and cricoid cartilages, and then covers the majority of the back of the pharynx. Is immediately anterior is the middle pharyngeal constrictor, which connects to the hyoid bone, and then in front of that is the superior pharyngeal constrictor, which connects to something called the pteromandibular raphe. The pteromandibular raphe is spelled kind of funny. It has a P in the front, but like in pterodactyl, the P is silent. In addition to the it's in addition to the superior pharyngeal constrictor, another muscle called the buccinator is also connected to the perimandibular raphe, and the buccinator actually is responsible for the contraction of your oral cavity. For example, when you're whistling, when you're forcing air out, the muscle to the left and right side, which is pressing against the air, is actually the buccinator.